So self-management involves the tasks that an individual must undertake to live well with one or more chronic health conditions. These tasks include, and I'm sure we're going to talk more about these, is dealing with the medical management. So I've got to learn about my condition. I've got to learn how it is medically managed. When do I need to see my physician? I'm going to learn about the role that I need to take in my management. What do I need to do at home that could help me manage my condition? And then also, having a chronic health condition is we have to live with that emotional aspect in the sense of that, that our body might not be functioning up to par where we want it to be, and we have to deal with that emotional loss of that. And how are we going to deal with what the cards that are set in front of us? And that management is both an outcome and a process. So you're going to get a lot of information from your doctor, and that's one piece, but how do we act on that information to make some changes? So the purpose of self-management, you'll see this a couple times, is enable an individual to take action and help sustain his or her behavioral changes. One, capability for an individual to set goals, realistic goals. The ability for an individual to pursue action plans, making those goals move forward. Enabling decision-making to overcome barriers. And that's, I think, we all learned in the Stanford program, was that those barriers still come up. So how do we reevaluate, how do we problem solve to make our action plans more realistic? And the ability to monitor progress to meet the goals. Okay, so I wanted to, this is a little hard to see, but these are sort of the things, besides what, I think it comes to be a personal thing of how does it make me feel? I feel pain-free. I feel like I'm going to live my life longer. I might have time to spend with my grandkids. I'm managing my diabetes. I feel better about myself. But I think there's some pieces that need to come in. So know how to problem solve, which we talked about, and we're going to go into more detail. Actively share in decision making with the healthcare team, that you have a role in being actively involved in that. Yeah, so adopt lifestyles that promote health, monitor symptoms between your visits. So you have a role there that you need to keep up on that because you're going to share that with your healthcare team. Who feels that they have a really good partnership with their healthcare provider? Okay. Who feels that they have a good... So that's part of your team there. Who else would... So we're going to talk about your team. So those are important, is that how do I make that better? Because I have a role in that too, right? Just as much as they have a role, I have a role. So there might be some ways that I can make this better. There might be some ways that, there's always that I might have to walk and look for someone else, but that's hard because there's some physicians, there's not a lot of family doctors. So how do I make this better and work for me in my self-management? Yeah, so as we talked about, we have to be actively engaged. So we could sit on the couch or we could be actively engaged in our self-management. We're probably going to feel better about ourselves if we're actively involved in it. Yeah, so knowledge, definitely. You might need to, now the internet can be a scary place, but you might need to research. You might need to meet as a group. You might need to go to more information to help you move forward. And always remember, when you're learning information, it doesn't always happen all at one time. We probably take away 20% of what we learn at courses, and going back and learning more just helps us move forward in our management of our health condition. We didn't come equipped with knowing how this body works. So knowledge of improving our quality of life is going to be critical to making us have great outcomes, successes. So motivating self-management, using structured information and support. So where am I going to get the information from? What's a good resource to get some information from? And that could be such a benefit of meeting as a group like this, is that you can learn from other people of where they've searched things out that you might not have thought of searching. And I always think of when I had my diabetes, I always looked at it as I knew everything, I'm a diabetes educator. And then I started to take the blinders off and realize, you know what, those people in arthritis, they actually know a lot. And there's some things there that I could actually apply for my patients, but I could apply for myself just around my diabetes management, not anything to do with my arthritis. So it was interesting, like there's a lot of people, you might think, oh, you don't have diabetes, you don't understand, but a lot of people suffer from pain for different reasons, from different conditions. A lot of people there might be breathing problems, and how do we, or stress might bring on breathing problems. How do we deal with that? What is someone doing? How do we eat healthy? Care plans. Does anyone have a personal care plan that they've put together? That might be something where, notebook, but it's all, individual. How do we learn? How do we keep it current? So again, as we talked about, is enabling, so we're looking at taking action and helping sustaining our behaviors, and we're looking at setting individual goals, we're looking at pursuing a plan, looking at overcoming some of the barriers, and that's probably the thing was like, oh, it didn't work, it's like, we've never been taught to set realistic goals. And I think that that's one great thing about the Stanford program is you start to learn that you don't have to do it all. And actually doing less and setting a realistic goal might offer you some more motivation to move forward. So it's really learning that skill and how do we problem solve. And we're the only, learning from others in our group. And then also monitoring the progress, like how did I achieve it? So. And there's actually, Stanford has an app. So I have on my phone, I have my exercise and my healthy eating on my app. And then all of a sudden it'll pop up, you haven't looked at this, have you really succeeded on this? And you can keep track of your action plans. But some people, pen and paper work really well. And so for some people, that might be the way that we keep on track of it.